Chapter 10 discusses the mechanisms of infectious disease. So we'll talk about things like some of the classifications of the different organisms that can cause disease. We'll talk about different kind of environmental and host factors involved. We'll talk about some of the ways that microorganisms enhance their ability to affect or cause disease. And some of the information about the course of infectious diseases. So we'll start with just some basic terminology that you'll hear quite a bit in the discussions surrounding infectious disease. One is a host, and a host is any organism capable of supporting the nutritional and physical growth requirements of another organism. So, when we talk about infectious disease, the most common host we're looking at here, right, is the human body. So they provide the nutrients and the physical environment where a microorganism can grow and multiply. Infectious disease is the disease state brought about by the interaction with another organism. Colonization is the presence and multiplication of a living organism on or within the host. And it's important to distinguish colonization from infection. In colonization, we have microorganisms that are colonized on the human body kind of all the time, but they're not necessarily causing any sort of infection. They're not causing any damage to the host itself. They're just kind of living on the host, right? And so a common example of that is our skin is constantly colonized with staph. Our GI tract is colonized with things like E. coli. Microflora are bacteria inhabiting exposed surfaces of the body. So again, microflora are things that I kind of just described in the notion of colonization. And virulence is a term used to describe the disease-inducing potential. So some microorganisms have very low virulence. So even if someone is exposed to that pathogen, the chance of them developing disease is quite low, and other pathogens are quite virulent, meaning exposure to those microorganisms are highly likely to cause disease. So some other terms, pathogens are microorganisms so virulent that they are rarely found in the absence of disease. So if someone is exposed to a pathogen, or if we find a pathogen, we probably also have an accompanying disease. And the final is parasitic relationships. And in these relationships, only the infecting organism benefits from that relationship. So if the host sustains injury or pathologic damage, the process is called an infectious disease. So this is what we call the triad of infectious disease. And the 3 points of the triad or triangle are the host, the environment, and the agent. And so all 3 are important components when we consider whether or not a pathogen is causing disease. So it's an important point to mention that not all presence of bacteria or microorganisms is bad. Some microorganisms, some bacteria are present and they are helpful to the organism. Infection and colonization also are often used maybe interchangeably, but they are not the same thing. And disease severity really relies on many things, so including virulence of the agent itself, right? How likely it is to cause disease. It's also very dependent on the host themselves. So a really healthy host with not a lot of maybe comorbidities, who is not at extremes of age, will probably not typically see as much illness or seriousness of a disease as someone who maybe has more comorbidities or is maybe immunocompromised or takes medicines that would affect the severity of illness. And the final thing is environmental conditions. There are certain environmental conditions that make it more likely that a disease process will occur. And so all 3 pieces are, again, really important for the process of infectious disease. So these are the different types of infectious agents that can cause disease: prions, viruses, bacteria, rickettsia, chlamydiaceae, fungi, and parasites. And I have viruses and bacteria highlighted because they're really going to be where most of our focus is. We'll talk briefly about some fungal infection kind of pieces, but for the most part, we're going to focus on viruses and bacteria because they are really by far the most common human pathogens. So we'll start with viruses. Viruses are our smallest pathogens. Some characteristics are that they have really no organized cellular structure. They're really just a protein coat that surrounds nucleic acid, which is either DNA or RNA, and they are completely incapable of replication outside of a living cell. They have to invade a living cell to be able to replicate. And when they invade, they may kill the cell they're using for replication, or they may not. They may actually enter a cell and start to replicate and not cause disease for years. We call those latent viruses. Or they may show up later and cause what we would consider the primary disease. Or sometimes they may remain latent or dormant in tissues and show up later as entirely something else. And the example I would use there is the herpes virus that causes chickenpox, right? When someone is first infected with that virus, they show up with the classic signs of chickenpox. But then that herpes virus can revert and live within nervous tissue for years and continue to kind of grow and replicate kind of slowly, but it's latent. It's not causing any active disease. But then all of a sudden it might emerge as something entirely different. And in the case of chickenpox, that emergence takes the form of something like shingles. And some viruses, things like herpes, or not herpes, human papillomavirus can cause things like malignancies, Epstein-Barr, and Burkitt's lymphoma. So some viral infections lead to the development of malignancies in the host. Bacteria are classified by several different mechanisms. Sometimes we classify them by whether they are single or double-stranded DNA. We will classify them based on their cytoplasm and cytoplasmic membranes, the type of cell wall that they have. And the cell wall often determines the shape. So you can see in the picture there are a lot of different shapes of bacteria, and we often use that to, again, classify them. Because that's really, their appearance is really how we determine what kind of infection someone is dealing with, and that in turn will often drive kind of the choice of treatments like antibiotics. But bacteria are autonomously replicating unicellular, single-celled organisms, and we call them prokaryotes because they lack an organized nucleus. Another classification that's quite important for bacteria are whether they're aerobic or anaerobic, meaning do they need oxygen to survive, or can they grow and replicate in a oxygen-deprived environment? Kind of very kind of important classification and distinction when we talk about bacteria. Other classifications are really based on maybe their microscopic appearance. We also can stain the cells. When we talk about a gram-positive organism, it means it's stained purple. When it's gram-negative, it's not stained by crystal violet preparations that we see in laboratory settings. Fungi, again, I'm not going to talk too much about them, but this group contains things like yeasts and molds. Probably some of the most common fungi that we see are things like yeast infections that tend to grow on a host in kind of like dark and moist environments, like on the skin, under maybe breast tissue, or in things like vaginal infections. We also see these infections crop up in opportunistic ways, maybe in the oral cavity that require treatment. Fungi can also get into places like the lungs through inhalation. Fungal infections, especially those that kind of get into the lungs, can tend to be really difficult to treat because of the structure of those microorganisms and the difficulty in getting kind of like penetration of drugs through those fungal infections. Some terminology too related to the incidence of infectious diseases. When we talk about a disease being endemic, it means that that disease is found in a particular geographic region. So the incidence and prevalence are kind of expected of that disease and relatively stable over time. Um, One of the things, during the COVID epidemic, what we talked about, right, was that eventually that disease would really become kind of endemic to a lot of different areas, meaning it would really be constantly kind of circulating, but the circulation would be kind of predictable based on different environmental factors like time of year and amount of spread. So that's what we talk about with endemic diseases. Epidemics are infectious diseases that are abrupt and unexpected in their increase in the incidence of disease over endemic rates. So when something becomes an epidemic, it goes beyond that expected and relatively stable kind of incidence, and there's just a really sharp increase in the amount of people infected with that disease. And pandemics are a spread of a disease beyond continental borders. So when a disease that's normally endemic to an area starts to widely spread across the globe, that's when we consider that a pandemic. And often what we see is, a really, again, sharp rise in incidence and infection, because as something spreads out of its normal endemic area, now it's starting to infect people who maybe don't have sort of that natural or that kind of developed immunity to a disease, and so it becomes much more infective in a new kind of novel population. Another important thing to discuss surrounding infectious disease is their modes of transmission. And this talks about really how a disease is transmitted and how it gains access to the body. So one mode of transmission is something called penetration. This is through things like wounds or movement of GI bacteria, meaning that, again, we have bacteria that live in our GI tract. If those bacteria move and infect an area where they don't normally live, things like getting into a wound bed or maybe getting into the urinary tract of a patient, then they start to cause infectious disease. Other penetration related modes of transmission are things like bites, either human bites, animal bites, and another common cause is IV drug use, where we have pathogens entering directly into the bloodstream from dirty needles. Another mode of transmission is direct contact. So this is contact of infected tissue or secretions to mucous membranes. Um, so a really common example of direct contact, or probably our most common example, is how sexually transmitted infections are able to gain access to the body. And so they come into direct contact with the mucous membranes of the genitalia and then infect the host. Others are maybe congenital infections that transfer from mother to child. Another mode of transmission is ingestion. So this is direct entry of a pathogen via the GI tract. So common examples here are things like cholera or typhoid fever or dysentery, things like food poisoning or traveler's diarrhea, cryptosporidosis, Hep A. Those are all ingested types of microorganisms. And the final is via inhalation. So these are things that gain access via the respiratory tract. So things like bacterial pneumonias caused by strep or Legionella. Meningitis can enter this way, tuberculosis, as well as the viruses responsible for things like measles, mumps, chickenpox, influenza, and the common cold, the rhinovirus. We also classify infectious disease based on its source or where people kind of pick up this infectious disease. And so locations are either nosocomial, meaning they're developing in hospitalized patients, and the types of diseases we see in nosocomial infection are often different than those that people contract in the community, or what we call community acquired. And these are things or infections that are acquired outside of healthcare facilities. And we can also classify the source of infectious disease based on the host. Um, or the object or substance from which the infection was acquired. So these are discussed as being either endogenous or exogenous. So when the host is infected by something that is based from their own flora, like an opportunistic infection or like an E. coli infection of the urinary tract, we call that an endogenous infection. But when the host is infected by a microorganism that is exogenous in nature, that's something from outside the host. So examples of that would be infections picked up from water or food or from the soil or from the air, from other humans, from animals, from biting arthropods, ticks or mosquitoes, or things that they might just pick up from inanimate objects, right? Like tissues that have viruses on them, or toys that are infected with like a norovirus that gets transferred. So that's the difference between endogenous and exogenous. Um, a little bit about symptomatology of infectious diseases. So sometimes the symptoms that develop are what we call specific, and those symptoms reflect the site of infection. So if you have someone infected with something like norovirus that infects the GI tract, the symptomatology is going to be specific to that type of infection. And so the patient is going to experience things like diarrhea or vomiting. If you have an infection that attacks nervous tissue, you may have a patient who develops things like convulsions. If you have something that infects the respiratory tract, the symptomatology is going to reflect things like cough and sputum production because of the site of that infection. Non-specific symptoms are things that are shared by a diverse number of infectious agents. And a lot of the time, these are some of the systemic effects that we see. So things like fever, headache, muscle pain, those are non-specific symptoms of infectious agents. And often the symptomatology is obvious or predictable. If someone is infected by chickenpox or measles, we understand and we know what the symptoms are going to be, right? That they're going to be things like a predictable rash that develops on the skin. And sometimes the symptoms are more covert in nature. The symptoms are things like inflammation of the liver, which can be caused by a lot of different things. And so this requires laboratory testing to specifically detect the type of pathogen responsible for things that we see. Other examples are things like increased white blood cell counts. Any pathogen can increase our WBCs. So if that's the symptomatology that we see, and we don't see anything else, we might have to go searching for what the infectious agent is that's causing that problem. We also discussed disease course in an infection. So the first stage of disease course is the incubation period. This is the period when the pathogen has entered the host and it's starting to replicate. And in this stage, the patient really has no symptoms at all. They wouldn't even know they were infected. Nothing really is showing up at all. And so you can see on the graph here, infection is the start, right, of this course. And that incubation period is when someone is really experiencing what we would consider subclinical disease. And so the dotted line here is the clinical threshold. That's the point where someone might actually experience some significant and noticeable signs and symptoms. And so you can see during that incubation period, we're well below that clinical threshold, and someone is just hosting that infection and it's kind of growing and multiplying. This is important to understand because many diseases are still spreadable within that incubation period, meaning that even though you're not showing symptoms, you have enough of that pathogen present to be able to spread it to somebody else. So this is really an important discussion in infectious disease, whether or not someone can spread something during that incubation period. If people can spread a disease during incubation, that pathogen, typically viruses, tend to be a lot more spreadable or easily acquired in the community because people are spreading that disease around before they even know they're sick. The next stage is the prodromal phase. This is where symptoms may start to appear, but they're often quite vague. So it might be just maybe some mild fatigue, maybe some I don't know, maybe some mild like weakness, but things that people just kind of don't even notice or wouldn't even connect to an infection um, at all. And so here's that prodromal stage on my graph here, and you can see that typically the prodromal is still below that clinical threshold. So if there are symptoms at all, they're again very vague and maybe not even noticeable. The next stage is the acute stage, and this is where we see the maximum impact of disease on the host. And so the acute phase kind of starts right here, and you can see that now we're above that clinical threshold, and the severity of that illness kind of continues to sort of climb all the way through that acute stage. And the next stage is convalescence. Convalescence starts kind of right here once we've reached our peak of illness. And that's when we see containment and elimination of the pathogen by the host, either on their own or through the help of maybe different medications that we can use to slow that pathogen. But that's where someone starts to head back towards that kind of clinical threshold. Okay. And the final stage is resolution. And resolution is where we see total elimination of the pathogen and where the host is completely back to normal. There's complete absence of any signs and symptoms. But of course, as with anything, there are always exceptions. Not every single infectious disease will travel through this exact course of infection. So some exceptions to this might be things like a chronic infection, where someone gets past that acute stage, they reach that maximum level of illness, and they start to head back towards clinical threshold, but they never really get there. There's always this sort of chronic infection and some signs and symptoms, and there's no true elimination of that microorganism from the system. Other infections are things called subclinical disease, and you can kind of see that in red here, where someone is infected, but they never really go past that clinical threshold. So they kind of just carry that infection, but they don't necessarily show signs and symptoms of the disease. That was another important piece kind of during the COVID pandemic, where some people probably became infected with that virus, but never really showed symptoms and continued to just sort of spread it, but without becoming sick themselves. And the final exception are fatal infections. And so if someone climbs through that acute phase, but becomes so overwhelmed by that disease that it becomes fatal, of course, they don't go back through, right, that convalescence and elimination. Other factors that influence the site of an infectious disease are the type of pathogen, of course, will influence the site. So many pathogens cannot cause disease outside of very specific areas. Like influenza is not going to cause disease outside of the respiratory tract. H. pylori is not going to cause disease outside of the GI tract. But there are some diseases, things like Lyme's disease, that can travel far from their primary site to a lot of other locations and cause disease in a lot of organ systems. Staph lives on the skin and can cause a lot of different types of infection. And that one is often based on the type of infection we see from staph is often based on its portal of entry. Where does staph enter the system is what will dictate kind of the type of infectious disease that we see. And the final factor is, of course, the competence of the host's immunological defense system. The stronger the immune system, the less likely that we are to see infectious disease, even if a microorganism enters our host. If the host immune system is strong enough, they may contain that microorganism before it even shows signs of disease. And for other people, they may develop infectious disease from microorganisms that wouldn't typically cause disease in anyone if they're, immunocompromised enough. So that's a very important factor. So another discussion surrounding microorganisms and pathogens are their virulence factors. So remember, virulence is kind of the ability or how easily or how often a pathogen can cause disease. Highly virulent microorganisms are things that almost always cause disease if someone comes into contact with them. So what are the different things about a microorganism that might increase its virulence or its ability to cause disease? So virulence factors are substances or products that are generated by the infectious agent that can enhance that infectious agent's ability to cause disease. One common virulence factor are toxins. Toxins are substances that alter or destroy the normal function of the host or the host's cells. So toxin production is a trait primarily monopolized by bacterial pathogens, and they can produce exotoxins or endotoxins. So exotoxins will help them invade a host cell, and endotoxins are things that they might release within the host that will cause more damage to the host cells. Pathogens must also be able to also have the ability to stick to the host to be able to cause infection. So these are things called adhesion factors, which again are present in that microorganism that can enhance their ability to stick to the host and cause disease. Some organisms will encapsulate themselves or cover themselves in something that helps them evade the natural killing mechanisms of the host cells. We call those evasive factors. So again, those are things that a microorganism might do to prevent themselves from being killed by the host. And the final thing are invasive factors. So these organisms often have enzymes that facilitate their entry into the host. It's often the combined effects of invasive factors, toxins, and antimicrobial and inflammatory substances released by the host to counter infection that mediate the tissue damage and the pathophysiology of infectious disease in general. So what are the criteria for the diagnosis of an infectious disease? Well, one is that we can recover or find the probable pathogen, or we see evidence of its presence from an infected site of the disease host. And the other criteria is that we have accurate documentation of clinical signs and symptoms, or the symptomatology that's compatible or usual for an infectious process. And the different techniques that we can use in the lab to diagnose or find infectious agents include cultures, where we take a sample from the host and we put that sample into a laboratory preparation, and we allow that microorganism to kind of grow and divide to see what's in there. That's a culture. We can also look at serology or serum tests, and what we're looking for there are characteristics of an antigen or things like antibodies that we can find in the serum. And we can also do DNA or RNA sequencing of the microorganism itself to determine what type of infectious agent it is. Treatment for microorganisms. We have a lot of different types of antimicrobial agents. You guys will study these extensively in pharm, so I'm not going to really go into them here because you guys will talk about antibacterial, antiviral, antifungal agents, maybe a little bit about some of the antiparasitics. So I'll leave that discussion for your pharmacology course. But there are also some non-pharmacological interventions that we sometimes have to employ to fight infectious agents. One thing to understand about antimicrobial medications is that how successful they are in treating a disease also depends on the host themselves. And so we want to make sure that our host has as many kind of tools to fight an infection in addition to the antimicrobial actions. So it might be things with the host and ensuring that they have adequate rest and fluid and nutrition to try to help those medications along as they're working. But sometimes if an infection is severe enough, it may require surgical intervention. For instance, if a patient has developed something called an abscess, which is a collection of kind of purulent fluid under the skin that also might contain microorganisms, that can be a very difficult thing for medications to penetrate into an abscess. So we may have to go in and physically, surgically drain that abscess. I had also mentioned in our discussion on musculoskeletal things. If the infection resides on a implanted kind of device that doesn't have a blood supply, it may need to be removed surgically. We may need to clean the site of infection. So something like a wound may need to be debrided, where we physically go in and clean out some of that infection. And sometimes we remove an infected organ or tissue. An example of that would be an appendectomy. Appendicitis is caused by an infectious agent getting into the appendix and causing inflammation. So the course of treatment for that is just to remove the organ itself.